Stay with us for the next segment of Kentucky Health when we talk about diabetes. It's more than what you think, and it's more than just sugar.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about diabetes. It is one of the most common diseases that's out there, and it's actually occurring with more and more frequency, not only here in the United States, but also worldwide. With us today is Dr. O'tayo Lalude, who is with the Westside Medical Center and part of the Jewish physician groups. Dr. Lalude, you're one of these people who's been certified as, I guess, an expert in the management of diabetes. Tell me about that.
Well, the recognition by the American Diabetes Association and National Committee for Quality Assurance was developed about 15 years ago to allow any physician in the United States who want to take care of people with diabetes to learn more about the disease. And the essential point here is that evidence has shown from the 1960s, 70s, and 80s that diabetes could be managed better, and people with the disease of diabetes can live a normal life if they are taken good care of.
Now, I used to believe that the management of diabetes was in the purview of the endocrinologist, the person who manages diseases of hormones and glands, etc. Now, that's no longer true then.
Well, it is true. The disconnect is that there are not enough endocrinologists trained in the United States to be able to take care of every person with diabetes in this country. Let's put some numbers into this. The entire country has maybe less than 5,000 endocrinologists. This is a population of 310 million people, United States, in the last census. And we have approximately 20 million people diagnosed already with diabetes. And there are close to about 60 million out there that do not know that they have the disease. In addition to that, we have a lot of children and adults who are overweight and who are carrying excess sugar in their body. We call them pre-diabetics. And it's estimated that there are 56 million or 60 million Americans out there with this disease. Now, will 5,000 endocrinologists be able to take care of these people? No. However, one thing we know, the general practitioners in America or in any country of the world are the first people who see patients or who see men and women and children who complain of any type of illness. So as a result, it turns out that, well, about 81% of everybody that has any kind of disease in America is seen by general practitioners. Some of them end up with specialists, some do not. But what it comes out to be is this. If you are lucky to be seen by the general practitioner of excellence who knows what your problem was and able to take care of it, you will do well. Your complication will be practically none. But if you are unfortunate to go into the office of the general practitioner, although he smiles, he's a good guy or a good girl, you see, but does not know what the nature of your disease is, well, you are on a rocky road till the end of the life, you see.
Now, what are some of the things then that one is taught when one is somewhat of an expert in the management of this condition?
All right. The crucial information that everybody who does diabetes, and we call them diabetologists, And the diabetologists could be people who have MD degree, they could have nursing degree, they could have a PA degree, they could even be diabetes educators. These are people who have dietary background or education background or PhD in science. The common focus here is this. What is diabetes is the first question everybody has to know. How do you diagnose the person early enough? And if you make an early diagnosis, you want to start an early treatment. And early treatment prevents complications. And that's the theme, okay, or that's the thrust of the whole diabetes recognition program. Although we use language like this, scientific language like metrics. And what metrics actually means is that, well, you draw a line, say this line is the normal line, below it is good, above it is bad. And those are the metrics. And let's give an example. Anybody who has diabetes, the word is out there now that the test for diabetes, which is A1C, we call it hemoglobin A1C. A1C is the absorption of glucose or sugar into your red cell, your red blood cell, and it stays in that red cell for upwards of 90 to 120 days. And you can pick it up in the laboratory when they use the laser test to make it. Therefore, anybody, whether in Asia, Africa, Europe, or America, who ate some sugar 90 days ago, if they have diabetes, that sugar was still hanging in the red cell, and it could be picked up today, 90 days later. And that's the standard test for diabetes. Some years ago, the number was 7 or 7%. Today, the number has dropped to about 6.5. And in fact, in the laboratory we use in my office, we use 5.7. Now, what does it mean? What it meant is that some years ago, there was a research done in England, and it's the largest type of research that's been done anywhere in the world. And that research was given the name UKPDS, which meant United Kingdom Prospective Diabetes Study. It was the government of the United Kingdom or Britain that said that, well, we're paying too much for amputation, we're paying too much for blindness. So we want doctors to figure out how to prevent blindness and amputation. So what they found out is that if you bring people's sugar down so that their A1C is about 7 or below, you have less amputation, less blindness, less heart attack, less stroke, and less kidney failure. But when people remain above that number, above the number 7%, then you have more stroke, more heart attack, more kidney failure, more amputation, more infection, and more premature death. And that's where the whole idea came from. And this was also supported with studies done in Japan. At the Kumamoto University in Japan, in Tokyo, they found that the best way to bring sugar down fast enough is insulin. And patients ask me every time, why is insulin important in diabetes? Insulin, you can describe it as the, maybe the transmission fluid of the body. It's very, very important. The insulin is the one that goes in and turn on the whole circuit of the body so that all the Krispy Kremes that we eat, all the steak and hamburgers that we eat, and all the ice cream that we eat, you see, before they can get to any cell of the body, insulin must be there to open the door to the cells. So essentially, the best analogy is that insulin is like a key. You see, like your car key or your home key. You've got to open the door to be able to enter the door. So if there's no insulin, the door to every cell of the body cannot open. Therefore, the sugar just floats around. The fat floats around. And that's what diabetes is all about.
Are you suggesting, by what you just said, that it is better to, when you're making a diagnosis of diabetes, that insulin therapy is better instituted early, rather than later, or you're just saying any means of getting insulin, be it the medications that stimulate the pancreas to make more insulin may also work, or are you saying you've got to go with the IV or the injections with insulin itself?
The answer to that is correct. Insulin therapy is the best therapy for diabetes.
The injection of actual insulin?
Well, I'm not saying injection yet.
Okay.
Insulin therapy, meaning that, well, the insulin made by the pancreas inside the body is, of course, preferred. So, and the only way to get that insulin inside the body to continue to work is for the person to eat less sugar, to lose weight, to be more active, and exercise. So you have that natural insulin being produced, and there's a natural balance in the body. However, in some people, the pancreas already is so weakened and so scarred down that it could not produce any more insulin. Therefore, you have to introduce insulin from outside. So, and that's why I use the analogy of the engine oil. So you have to add engine oil into the body so that there's insulin to go around the body to do it. And the confusion we have in diabetes is that a lot of patients all over the world, educated and uneducated, thought that tablets are substitute for insulin. They are not. There's no medicine that will work without having insulin on board, because insulin is the definitive agent of nature to open the cells to everybody.
What are these oral medications doing then?
Well, the oral medications are augmenters. They augment. That means what they do is this. One type of medication, we call them the sulfonylureas. This medication, they go in and squeeze the pancreas to make more insulin. Another group of medication we call metformin, which everybody uses all over the world. What they do is that they tell the liver not to make too much sugar, that the pancreas can produce insulin to mop it up, and at times they tell the muscle to be stable so that insulin can do its job. That means they reduce the resistance. The same thing they do in fat cell. Another group of medication which has been in the news are medicines like Avandia or Actos. You see. These are called the TZDs, or the long name is thiazolidinedione. What they do is that they prevent the resistance. That means they break down the resistance in the muscles and the liver so that insulin can go in and open the door. Another group of medication that we have in the last 4 or 5 years are called the GLP. That means when they were discovered, they thought that, well, they are related to glucagon, another type of hormone in the body. And these GLP related medicine, they come either in tablet or injectable. And what it does is that, well, they work on certain cells inside the gut to prolong, let's say, the activity of insulin so insulin can do its job. So I can go on and on and on. You see that, well, if you go up or you go down, you still come down to insulin. Insulin is the real biologic agent that we all need to be able to use all the carbohydrate, fats, and protein that we eat.
So it's going to be either trying to increase the effect of the endogenous or the insulin we already make ourselves.
Inside the body, yes.
Or if that doesn't work, then you have to bring in outside exogenous, and that would be the time for going to injections.
Yes.
When looking and evaluating the patient who has diabetes, you already stressed one point, following the hemoglobin A1C. What other things are you looking at for that patient, bearing in mind the complications that occur in the diabetic patient?
Okay. All patients who are diagnosed with diabetes, part of the metric, like I was referring to earlier on, include things we need to look for to tell us whether the treatment of diabetes is working well for them or is working against them. One of the things we look for is the eye. Everybody who has diagnosis of diabetes all over the world need to see the eye doctor, because people who are diagnosed for the first time with what we call type 2 diabetes, majority of human beings all over the world have type 2 diabetes. When I say majority, about 92% of all people with diabetes all over the world are type 2 diabetes. And at the time they show up, about 30% have eye condition. In fact, some people are picked up as diabetic because they went to see the eye doctor because they couldn't see. They have blurry vision. Another important part of the body that need to be checked are the feet, the sole of the feet, the toes, and the arms and leg. Because some people go to the doctor to say that, well, they've been having this tingling and numbing sensation, and they will not relate it to diabetes. And there are people, up to 1 out of every 5, that show up just with that, and they have diabetes. So people who do not have that at the time that you diagnose diabetes, you want to follow them so that they don't reach that stage. Because if they reach that stage, it means that they have damages to their body. Another thing that we noticed in the recent time is this. Studies from all over the world show that if Joe or Joan from downtown USA walks to the next emergency room complaining of chest pain, a lot of people who've never seen doctor, they showed up with chest pain, bingo, they say they have heart attack. And what they notice is that, well, about 8 out of every 10 people with heart attack have diabetes and they do not know it. So they have high blood sugar, or what we call hyperglycemia. So that's another condition that is very, very important. Now, how about dialysis? More and more people who have high blood sugar that they did not know it, but they were destroyed, but they got sick, and people found out that they have diabetes. These are people who eventually end up in dialysis because they lost their kidney, you see, from the disease. Now, how about throwing up? A lot of people out there throw up because they say they have indigestion, they have GERD or reflux, you see. We now know today that there are a handful of people who show up in the doctor's office and they got their blood test for the first time. They found out they have diabetes because they have a condition known as gastroparesis. So because their food cannot digest, they have too much acid and it just breaks through. And of course, since 1997, that Viagra came to the world of medicine, we have more men showing up in the doctor's office that are doc on the TV. They say, I can ask you for a sample of Viagra, you see. Yes, indeed, you can. But majority of these people do not even know that they have diabetes that might be part of their erectile dysfunction. Not only that, they may not even know they have heart disease that is part of the whole problem. Because the blood vessels going towards the male organ and the blood vessels that go towards the heart, to the eye, to the center of the body. So these are relative sizes of blood vessels that are already clogging up. So a man that wants Viagra, actually their life may be saved. And in my practice since 1997, we have taken care of, the last time we counted close to about 90 men who showed up just for Viagra, and it turns out that they have diabetes, you see. So they got their diabetes treated, you see. So, and infection. Infection is very common. People whose wound will not heal, or they have sinus infection that will not go away, or they have gallbladder infection, or some people who even have surgery. They were just in an accident and the wound was clean and they had surgery, which was okay. But then the hospital called later on and said, well, your blood sugar was 300 when we check it. The wound does not heal. And surgeons all over the world now know that people whose hemoglobin A1C is greater than 7, that means their blood sugar is approximately 280, between 200 and 280, do not heal. The wound does not heal because bacteria and other organisms love sugar, so they just eat the sugar on top of the wound. So we can go on and on. We can see that almost every specialty in medicine and surgery today has diabetes directly or indirectly related.
Let me ask you, if you would, like the ghost of Christmas present, Christmas future in Dickens' A Christmas Carol, Scrooge asked, is this the thing that will happen or this what may happen? So if one is diagnosed with diabetes, does it mean that these complications will develop, or does it mean that if we don't treat things well, that's the only way you'll see these problems? So can you prevent these calamities from occurring by good control?
The answer is yes. And that's why the campaign all over the world now, and the World Health Organization declared in 2007 that diabetes is the #1 epidemic for the entire world to deal with for the next 50 to 100 years, because we are seeing more and more diabetics. For instance, in our country here in the United States, we have about 1.3 to 1.8 million Americans converting into diabetes every year, which is equal to about 8,000 a day, you see.
What is a normal blood glucose level that we should try to maintain, the diabetic patient?
Okay, well, I think I would like to put it like this. The normal blood glucose for a man, a woman, a newborn, a baby, a child, or of any age should be less than 100. That's the normal blood sugar. Now, if one has diabetes, diabetes means that, well, their blood sugar at any time, whether they eat or they do not eat, their blood sugar is over 100. It could be 110, 120, 180. But somebody who does not have diabetes, within 2 to 3 hours after they eat, their blood sugar should be below 100. Okay? I don't know whether I'm making myself clear, but that's the best way to do it. So for somebody who has diabetes, the best way to treat them would be, we want their blood sugar to be below 120, better yet, below 110, superb, below 100. So if you want to see it that way. And that means the blood sugar of about 110 is almost equal to hemoglobin A1C of 6.5%. The blood sugar of 120 to 130 is equal to hemoglobin A1C of 7. So if you really want a normal blood sugar, the normal blood sugar should be about hemoglobin A1C of 5.7, which is equal to about 98 milligrams per dilution of sugar.
How hard is it for you to keep your patients under control?
It's very, very hard, because diabetes is a social and cultural disease. The environment, the more food we have, and America has one of the cheapest supermarket for food in the world, you see. Every corner of America, you see, it's a big basket of bread, you see. So it's very, very difficult. And the new way we counsel now is this: you can eat any food that you like to eat, but be rational in eating. That's rule number one. Number two, have more fruit and vegetables and grains in the meal. Cut back on refined sugar. Do not make Pepsi and Coke and Big Red and Southern sweet tea as your drink of preference. Drink God's Pop, pure water. You say pure water. And the reason for that is that the average person who drinks pop that is loaded with sugar or tea is approximately a quarter cup of sugar that we're drinking. So it makes diabetes worse.
Well, I want to thank you very much for those good suggestions. I think this is a very common disease. It knows no sexual barriers, racial, goes across all country lines. Diabetes is a problem. Weight control, proper diet. We have to be a little bit tighter as far as our glucose. I think it's important. If you have diabetes, you should be having your eyes checked, feet checked, look for your vascular system, make sure your heart's being checked on a regular basis. If you want more information about diabetes, feel free to contact us at KentuckyHealth@insightbb.com, or feel free to contact Dr. Lalude at the
Westside Medical Center.
Thank you very much, Westside Medical Center. I'll be more than happy to provide more information. Plus, go to your web and look for the American Diabetes Association. A lot of good information there. Dr. Lalude, I'd like to thank you very much for being with us, and thank you very much for joining us today for this segment of Kentucky Health. If you haven't talked to your physician, please do about diabetes. Thank you.